Hello and welcome to Uncle Matt's Online Academy. Today we want to talk about drug abuse. So we'll be looking at the meaning of drug, then we look at drug abuse, then we look at the drugs that are abused and many other things. So what is a drug? Drug means any substance that can change the physiology of the body and help us either in relieving us from illnesses or helping us to enhance our performance. A drug is any substance that when taken helps to cure diseases or help us to perform better or have other effects in our physiology. So we are identifying three things that help us to identify drug. One, they cure diseases. Two, they may help us to enhance our performance to do things better. And three, they can change our physiology. Our physiology means our body chemistry, the way our body works. So they can change or alter the way our body works. So these are the three things that help us to identify or define a drug. Now, drugs that are abused or drug abuse actually means when we use drugs in a way that they are not supposed to be used. Using of a drug in a way that are not supposed to be used is called drug abuse. For instance, we know that paracetamol is taken to reduce pain. When you start using excess paracetamol for some other reasons apart from its medicinal effects, you are abusing the drug. When you are taking codeine to bring some effects, maybe to make you happy or for you to do something better, apart from the way that doctors recommend it, you are abusing the drug. So any drug that you are using in a way that is not recommended for its use, you are abusing the drug. So drug abuse means the use of a drug in a way that is not, or in a way that is out of its recommended use. Drug abuse is the use of a drug in a way that is out of its recommended use. Now, we have three major types of drugs that are commonly abused. The drugs that are commonly abused, we have the one we call stimulants. We have another one we call depressants. And we have another one we call narcotics. So these are three major types of drugs that are commonly abused or that are commonly used in a way that are out of their recommended use. Now, stimulants. What is a stimulant and why do people abuse it? A stimulant is a drug that helps the brain to function faster. It increases the activity of the brain or makes it to perform its work faster. That is what we call stimulants. So stimulants, they work in the brain, or they have their effects in the brain, and their effect is to make the brain to work faster. They are recommended when someone is having some mental problem or brain problem that needs to be corrected by increasing the activities in the brain. They are recommended by doctors. But when someone starts using it, maybe to perform better in exam or to perform better in other things, then the person is abusing the stimulants. Example of stimulants are nicotine, 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 we have caffeine. Also, cocaine is also part of these drugs. So these drugs, they work in the brain and they make the brain to work faster. They are called stimulants. Then the depressants. What is a depressant? A depressant is a drug that works on the brain or in the brain and reduces its activity or slows down the activities of the brain. A drug that slows down the activities in the brain is called a depressant. So when someone is having too much mental activity in the brain, to reduce the mental activities, doctors recommend a certain type of drug called depressants to reduce it. People that are suffering of epilepsy or seizure, they have too much mental activities in their brain, and therefore depressant is always recommended for them. So depressant, they have good use. These are the normal recommended use of depressants. Now, but some people will want to use the depressant on their own without being recommended by a doctor, and they will start abusing it. So that is not a nice way to use drug. Example of depressants include alcohol. Alcohol causes depression. It reduces the mental activity. So any person drinking alcohol and thinking that the person is eyeing himself or high himself, the person is not actually high himself. The person is reducing the activities in the brain. Alcohol is a depressant. Even if you feel high after drinking it, after a while, it will come back and start making the person to feel, or the brain to feel, or to work slower. 2, the barbiturates. There's a drug we call barbiturates. Barbiturates, they are also depressants. If a patient is finding it difficult to sleep in the hospital, a doctor may recommend barbiturates to help the person's brain slows down and sleep, and for the person to sleep. Example of barbiturates are Amytal and phenobarbital. Amytal and phenobarbital. So these drugs, they are recommended to help people slow down their mental activities. People that cannot sleep, they are given depressants, because if someone cannot sleep, it is often because the brain is overworking. So to slow down the working of the brain, the doctors will give them depressants to slow down the working of the brain and help them to sleep. But when someone starts taking alcohol anyhow, or start taking any of these drugs, Armital or phenobarbital anyhow, the person is abusing the drug and it is not good. Then the third group of drugs that are commonly abused are narcotics. Narcotics. Narcotics are drugs that kill pain. Drugs that kill pain. They are also called painkillers. So if the doctor does not or wants someone to reduce his pain, the doctor will recommend a painkiller like paracetamol and other drugs. Now, when the pain is very extreme, doctors can recommend drugs like codeine, morphine, heroin, and opium. Now, these drugs help to reduce extreme pain in the body. They are all narcotics. Codeine is a narcotic, morphine is a narcotic, heroin is a narcotic, opium is a narcotic. Please note that all narcotics are painkillers, but not all painkillers are narcotic. Paracetamol is a painkiller, but it is not a narcotic. So all narcotics are painkillers, but not all painkillers are narcotic. Paracetamol is in another classification of drug. So the ones that I said that are narcotics are codeine, morphine, heroin, and opium. So when you start taking this drug, apart from their recommended use by doctors, you are abusing these drugs. So I said they are codeine, morphine, heroin, and opium. So these drugs are narcotics. So in this lesson, we've talked about, or we've learned about the meaning of drug, the meaning of drug abuse, and kinds of drugs that are commonly abused, which we said are stimulants, depressants, and narcotics.